Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are welcoming former attorney for the Social Security Administration, Spencer Bishins. Spencer worked for almost 11 years helping with the process of Social Security disability for the SSA, and he is now the author of the book, Social Security Disability Revealed. Welcome, Spencer.
Thanks for having me.
You're very welcome. So, Spencer, let's start with a little bit of background about your experience. You were working for the Social Security Administration, and kind of share with us, our viewers and listeners, what it was your role was there.
Sure. So I was hired in 2010 at the Appeals Council, and that's the part of Social Security that reviews appeals of cases that have already been in front of a judge. They've already had a hearing. A lot of cases at that level, as you would think logically, were denials, because that's who appeals, right? You get denied and you appeal. But actually, I was in a separate division that also reviewed favorable decisions. Who would appeal a favorable decision, right? Like, that doesn't make any sense. Well, for quality control purposes, Social Security randomly selects some favorable decisions just to make sure those are also being done correctly. And so I had a mix of cases that were approved and denied, and I was reviewing them on appeal. I was there for almost 4 years, and then I moved to the hearing level, where I was actually working for administrative law judges, and I was writing the actual decisions, and I was there for about 7 years. So a total of a little under 11 years. I wrote almost 2,000 decisions for administrative law judges. And because appeals go so much faster because they're already written, I was able to review a few thousand more on appeal during the time I was at the Appeals Council. So I've seen my fair share of Social Security disability cases.
Okay. So for viewers or listeners who might be, a family member or even a patient or somebody that is dealing with an injury or an illness, how does a person prove that they are disabled? Would that be different if they're doing it from home versus, say, in a nursing home or a facility of some type?
I do think there might be some differences. And the key with every disability case, it's all about the medical evidence. So the definition of disability is the inability to do full-time work on a regular and continuing basis due to medical impairments. Part of the definition is that you have to show that you're unable to work for a period of 12 continuous months. And of course, the way you prove all of this is through medical records, either your treatment records. It could be a doctor that you saw just one time. Think like a workers' comp type claim where you might see that doctor once or twice, but they're not really your treating doctor. We see military records, VA records. There's all kinds of different places that people go for medical care. And one of those places might be to a nursing home type setting, or getting in-home care, but from a medical source that would still be documenting everything and providing you with medical records. The problem I see in a home care type situation is I'm not sure the extent, just because I'm not a doctor and I don't have a lot of experience with care facilities like you do. I'm not sure how extensive those records would be. And particularly in an in-home care setting, I'm not sure if someone would be seeing if a doctor's coming into the home, or if it's nurses, and if it's just to provide like rehabilitation, physical rehabilitation care, or if there's actual examinations that are taking place. So the problem with receiving care at home, one problem that I would think about or would be able to foresee is the extent of the care being received, and therefore the extent of the documentation to show Social Security the extent of the disability.
Okay. And you mentioned a good point with care being provided in the home, whether it's through a visiting physician, a visiting RN, or with services like ours with, CNAs and caregivers. Really, there is no one size fits all. It could be for any number of reasons, and they could be receiving any number of services as well. So it does vary on a person by person. But one of the things that seems to be, I would say, almost maybe common knowledge or something when you think of the Social Security disability process, at least for myself, is I've always heard that the approval rate is very, very low and it's a high denial rate.
Yeah.
Why do you think that is, especially when people are submitting, medical records showing they are disabled or are unable to perform, a job for 12 continuous months?
So you just said something very interesting. People are showing records showing that they're unable to work. Who decides if you're unable to work, right? Everyone who applies for Social Security disability does so because they truly feel that they're unable to work and that they should be entitled to Social Security disability benefits.
Right.
But it's a really high standard. It's really strict standard to meet to show that you can't do any work that exists in significant numbers in the national economy. So a really popular claim is from warehouse workers. I don't know why, but warehouses are just really dangerous places and people are constantly becoming injured. I've seen so many warehouse cases when
Really?
I worked for Social Security. And the thing is, if you're working in a warehouse, let's say you're a forklift driver, that's what you've been trained to do, and that's what you've been doing for 20 years, and then you become injured, your thought process is, I can't go back to work. I'm disabled. I can't go back to my forklift driver job. And that's a logical thought process.
Sure.
That's a totally normal thing to think. But that's not Social Security's definition of disability. That 44-year-old forklift driver, well, they're going to be told by Social Security, if you can do any other work that exists in significant numbers in the national economy, you don't meet Social Security's definition of disability under the law. So that forklift driver might think, well, I don't know anything else. I don't know how to do anything else. This is all I know. But that's not the law. The law says if you can do other work that exists in significant numbers in the national economy, even with your medical impairments taken into account,
Hmm.
then you're not disabled under the law. In other words, Social Security is only paying disability benefits to people who can't do their past work or any other work. But there's a couple other reasons that there's a high denial rate, particularly at the initial level. One is we just don't have a great medical record keeping system in the United States. Even when you go see a doctor in their office, it can be hard to get documentation. It can be hard to get those records. Just in the last few years, trying to get my own medical records, I've had doctors tell me, we'll print them out for you, or where can we fax them to? They tend to be disorganized. Sometimes, whatever you said at your first appointment for medications you've used, 5 years later, those medications are still listed because no one removed them.
All right.
So it's just the way that we keep track of medical records in the United States, it's a mess. And so what happens is the records that you can get, and sometimes you just can't get certain records, and then the records you can get are often disorganized. And so when you present your case to Social Security, it's no surprise that there's gaps, there's inaccuracies, things are incomplete or contradict other records, even though you told two doctors the exact same information. And so what Social Security has is this incomplete story of your life and your medical situation. And so it's no surprise that so many people, more than 70% of people, get denied at that initial level. Unfortunately, there is another reason why people get denied, and that is that the Social Security Administration incentivizes their decision makers to deny claims. I
Oh,
talk about this in the book that
right.
if you think about it, who administers Medicaid? It's the states and the federal government in a joint effort to administer Medicaid, right? But when you apply for Social Security, it's the state that you live in that makes the initial determination as to whether you're disabled. So if they have an SSI application and they know if we approve this application, this person's probably going to also get Medicaid. Well, there's a conflict of interest there, isn't there?
Sure.
Because then the state is incentivized to deny more cases so they don't have to pay out as much in Medicaid benefits because states can't run a deficit like the federal government. So states will go and they'll hire doctors to see you, and you think, the claimant just thinks, oh, this doctor is going to tell them I can't work and I'm disabled. But the state is literally paying that doctor to give them an opinion that says you can work and you're not disabled.
Well, and isn't that why they usually select those certain doctors? Because they know there's a higher probability of getting a favorable outcome that they're seeking rather than for the patient?
Right. And it's not so much even just, yes, the Social Security does choose the doctors, but it's also just that even if that doctor might be more sympathetic to their patients, they know who's paying them.
Right.
So if they want to keep getting those cases, they know what their client, which is not the person being seen, it's Social Security, that doctor knows what they need to put in that opinion if they want that state to keep sending them Social Security cases to review. So it's one of those things that no one wants to talk about, but we all know it's happening. And so I talk about it in the book because I think it's important for patients, whether they're having to go into a doctor's office or receiving care at home, to understand how the process works and understand that not everything is being done in their best interest.
Well, and just to follow up on the physician side, and those are considered IMEs, independent medical evaluations. I have literally had physicians tell me that they get 4 to 5 times the fee for doing an IME than they would if that patient came to them and hired them, if you will, and saw them on their own.
I'm a bit surprised by that because the information that I've gathered is that they really don't get paid very much, especially because they're not having to fight an insurance company, right? The government just gives them a flat fee, whereas if they see someone in their office, they have to submit it to insurance.
When I would clarify, yeah. And I would clarify, Spencer, I'm not referring to physicians who are doing IMEs for Social Security. I'm referring to, auto accidents, workman's comp cases.
Yes, they
do
get paid a decent amount.
Yeah.
But for Social Security, they don't pay them a lot.
Okay.
And so the way they do it, and I know some of this because one of my own doctors a while ago told me, we were just chatting during the appointment, and he told me that he was also on the weekends moonlighting doing Social Security evaluations. And what he told me is he would get 24 cases on a Saturday, and he would try and do them in about 4 or 5 hours. So he was spending about 10 minutes with each person.
Wow.
And it's just the volume business. He would spend 10 minutes, try and get that record quickly, dictated, and then move on to the next person. And, just kind of go around in a circle to all those waiting rooms 4 or 5 times in one day.
Wow.
And yeah, that's pretty normal because I know from reading records that people get about 10 minutes with a physical consultative examiner. And then the fee is like $100, $150. It's not a lot, but it's a lot when you can do a lot in one day.
4 or 5 hours. Yeah. I mean, that's a quick Saturday pickup for them.
And no insurance companies are involved.
Right. Wow. So let's talk more on the caregivers, the care workers, and the healthcare professionals. So let's say somebody's a care worker or a healthcare professional. Why would they need to read this book?
It's really important to understand what your clients are going through, what your patients are going through. Because what I found is a lot of medical providers, they want to help, they try and help, but they don't totally understand the process. They don't understand all the barriers that are put up in the patient's way as that person is trying to apply for disability. So someone might come in and say, oh, my disability got denied. Well, a lot of doctors might think, well, that means you're not disabled then, or I guess your symptoms aren't that severe. But that's not true at all, of
Right.
course. As we've been talking about, the person could have really significant symptoms and be unable to work. And it might be a barrier with the application process, with the record keeping, with record gathering, with submitting information to Social Security. And then if you submit all that information, you have to deal with this doctor who's being paid to say you can work and you're not disabled. And then you have to deal with the fact that the person reviewing your case works for a state that doesn't want to pay Medicaid benefits. And now they have an incentive to find you not disabled. So there's all these things that the patient has to deal with that the doctor might not understand.
Right.
The other thing that medical professionals need to understand is if they want to help their patients, they need to know how to do it. When I worked for Social Security, I can't tell you how many times I saw a medical opinion that said something like, my patient can't work, please approve them for disability. Or my patient is disabled. Mr. Smith is disabled, please approve his Social Security. And a doctor might think, I'm wearing a white coat, I have MD after my name, I've said this person's disabled, here you go, Mr. Smith, you won't have a problem. And what neither the patient or the doctor understand is that when the Social Security judge gets an opinion saying my patient is disabled, the first thing they do is completely ignore it, because disabled is not a medical term. Disabled is a legal term defined in the Social Security Act and Social Security regulations. Only the judge gets to decide if someone is disabled. So that statement that I just told you from the doctor is completely meaningless and will be disregarded by the judge.
It's incredible.
Yeah, and even if you go further and you say, my patient can't work, I'm the doctor, I decide you can't work, the Social Security judge will say, saying someone cannot work is tantamount to saying they're disabled. That is a decision I get to make as the judge. I'm disregarding that opinion as well. So the doctors have to know how to help the patient. And what a medical opinion needs to say is why someone can't work. Not that they can't work, but why. Here are the specific limitations you have on a function by function basis. Here's how many hours a day you can sit, stand, lift, carry. Here's how many, from a mental health standpoint, here's how much you can interact with other people, concentrate and remember, understand, apply instructions, be supervised. You know, my patient has significant depression and could only be supervised for 2 hours of an 8-hour day. That is a very specific medical opinion that the judge can use to say, that person can't do an 8-hour day if they can only be supervised for 2 hours a day, right?
Right.
But just saying, my patient can't work a full 8-hour day, that doesn't tell the judge anything from a medical standpoint. And the other thing is, even if you have a specific function by function medical opinion, you then have to cite to the actual medical evidence to justify it.
Mm-hmm.
And so, and this is why Social Security is so difficult to be approved for. Even if you get past all the barriers we've already talked about, you've got to show the judge what your functional limitations are, why they prevent you from working, and then you've got to show some actual objective evidence, which could be an MRI or X-ray, it could be a blood test, or it could be psychological testing if it's a mental health impairment, but some sort of specific observable result, test result, that justifies the limitation your doctor is putting forth. And it's just really hard to prove a disability claim.
So I just want to circle back really quick on the appeal process, Spencer. And you mentioned what's triggering this is the judge saying, I make the determination, not the medical doctor. Right. Are these judges, are they trained in any way, or do they need any training in any way, depending on how this process is done, to have a medical background? Because I'm just thinking, as a viewer or listener, I would be wondering, okay, if my doctor says I can't work or I'm disabled, and, with SSA, it's a legal term rather than a medical term. And that
Right.
judge who has no healthcare background is going to override a medical doctor's diagnosis, if you will. How do those two work together, or how does that play out?
Yeah, so the judges and the staff attorneys who write the decisions, and that was my job, are given pretty extensive medical training,
Okay.
but not medical training like a doctor would be on how to treat a person, but training on how to read and understand medical records. Because that's our job as lawyers. It's not to look at what a person's doing in the exam room and say what their limitations are. We leave that to the doctors. But if a doctor then says, here's what the limitations are, we need to be able to look at the exam, the test results, and make sure that statement is supported by medical evidence. And if it's supported, then we can say, okay, well, that's pretty persuasive because we have an opinion, a medical opinion.
Mhm.
It's actually supported by objective evidence. And then we can say, okay, well, we'll give that a lot of weight and support in finding that person can't do whatever it is the doctor says they can't do. And then we have to get vocational evidence to say, are there any jobs with someone with that limitation, any jobs that that person can do? So let me give you an example.
Yeah, please.
Most common reason people apply for disability is back injuries. So let's say you have degeneration of the discs in the lumbar spine. Really common reason that people apply for disability, particularly when they're in their 40s or 50s. And those discs just wear out over time. A doctor could say, well, you've got moderate degeneration. I think you can stand and walk for 8 hours a day and do light work, and you could be a cashier. Or a doctor could say, my patient is in so much pain because of this degeneration, they can't work at all. They can't stand and walk even 2 hours per day. The thing with back degeneration is it's really subjective in the sense that there's people who have I could look at the same MRI for two different people, and one could say they have debilitating pain, and the other could say they really have no pain at all. Because people just experience pain differently, right?
Right.
So, but the thing is, that is at least evidence that could support a decision either way. But if I have an MRI and the radiologist says there's just mild degeneration and it's normal age-related degeneration, and that person's allegation is I'm in so much pain I can't stand more than an hour per day, and the doctor says my patient says they can't stand more than an hour per day, that is a medical opinion that has a function, but it's not supported by that MRI report, which is showing normal age-related degeneration, right?
Mm-hmm.
So that's why we're trained in how to know and not just take what the doctor says as gold. We can only take it as gold, as like spot on, great evidence, very highly persuasive evidence, if there's something objective to support it. So if we have some kind of MRI or X-ray or surgical report or something to justify that limitation, and that's what we're given training on. What is good evidence from an objective standpoint to justify that limitation? And then we're given that training for all kinds of impairments, lung impairments, digestive impairments, mental health impairments, all kinds of different reasons that people apply for disability. We need to know an impairment, this type of impairment generally causes these limitations. And then we generally get these types of tests. For example, if it's COPD, I'd imagine a lot of people needing in-home care probably have emphysema, COPD. I know I need to look at the pulmonary function testing. So as the person writing the decision, I'm going through the record. That's what I'm looking for. Show me that pulmonary function testing. I want to go straight to that person's lung functioning because I know that's the best objective evidence. And I know that from, the limited quasi-medical training that the lawyers who work for Social Security are given.
And you just brought up another point when you were talking about, again, just because that person couldn't do the forklift driving, that doesn't mean they're disabled, in SSA's opinion, from being able to do some other job. Now, is there any consideration for someone who, let's say they were earning, high low six figures, whatever the case may be, a more white collar type of job. And all of a sudden they can no longer perform that job because of a medical reason, and they're applying for SSA. And let's say they could, watch security cameras at the mall.
Right.
Is there anything?
That's an actual job. That's an actual job, by the way.
Yes.
It's called surveillance system monitor.
Okay. But does SSA take into consideration, or is there any thought given to the fact this person was an income earner at this level, and now okay.
It doesn't matter.
It does not matter. Okay.
If you're approved, how much you get will be based on your previous earnings and the taxes you paid in. But this sequential evaluation process for determining if someone's disabled, at the step 4 out of 5 is, can you do your past work? If the answer is no, and a lot of times the answer is no, you can't do your past work, and that's why you applied for disability, right?
Mm-hmm.
But at that last step of the sequential evaluation, question is, can you do any other work that exists in significant numbers in the national economy? And so it doesn't matter how highly skilled the job was that you used to do, anyone can do an unskilled job. Jobs in the national economy defined by the Department of Labor are either unskilled, semi-skilled, or skilled.
Okay.
And there's something, a document called the Dictionary of Occupational Titles that defines each occupation in the national economy, gives it a unique code, and says its skill level on a rating from 1 to 9. Or I think it's 1 to 8. Anyway, so unskilled jobs are an SVP of 1 and 2, and they can be learned in under 30 days. And because we don't want to say anyone has skills that they don't have,
right,
most times Social Security will just decide, can you do other work in the national economy, and only unskilled work. And that's work that anyone can do. So even if you were an orthopedic surgeon before, doesn't matter. If we say, okay, surveillance system monitor, that's a sedentary, unskilled job. If you can do that job, and if a vocational expert tells us that exists in significant numbers in the national economy, a judge can find you not disabled.
Okay.
Other popular ones are cashiers, a really popular one, just because there's over 1 million cashier jobs in the national economy. But there's other sedentary jobs. So even if the issue is my back, my knees, I can't stand. I can't be a forklift driver because I can't stand. Well, can you sit all day long? Yeah, I can sit, but I can't stand. The judge will find you not disabled because you can sit and do sedentary work. And that, by the way, is why it's really important for anyone who's applying for Social Security to have a representative, whether it be an attorney or non-attorney. I talk about this in the book, Social Security Disability Revealed. It's important to educate yourself,
right,
but also to have professional representation, because I have seen a lot of cases where people were not represented and didn't understand the rules and did what I just said. They came into the hearing, the judge said something like, well, do you have any problem sitting? And the person said, no, I can sit just fine. They didn't understand the rules and the law. And
right,
they didn't understand that by saying they had no problem sitting, they were admitting that they could do sedentary work. And so that becomes a really easy denial for the judge. So you really need to have someone representing you who knows the nuances of the rules, who knows how to present your case, so you don't accidentally literally tell the judge you're not disabled when you didn't intend to do that.
Exactly. Well, and so we have a copy of the book, and I've admittedly I've not read through it all yet, but when we initially met and we were discussing this, I ordered it that same day. And it's really fascinating because this is something that, again, I think kind of like other fields in healthcare and, even societal, services and resources, people either have a misnomer about it or a misperception, and they don't truly understand it. Like you're saying, people go in without representation, and he or she probably just, voluntarily was just thinking they're answering the judge's honest question, right? Which we all need to do, but didn't realize the ramifications of what that question was really being asked for. So that brings me to this question, Spencer. When our viewers and listeners are watching and listening to this, and they're saying, well, why do I need your book? First, I highly recommend it because it is a very helpful book and it's very fascinating. And but they just say, well, why can't I just hire an SSA lawyer to handle everything for me?
Yeah.
How would you answer that?
It's a great question. And that's what a lot of people do. A lot of people, they apply, they think they'll be approved, they get denied, they go to a hearing with a judge, and that's the point where they go, oh, this isn't going to be easy. I got denied. I thought it was going to be approved and I was denied. Now I'm going to go hire a representative to represent me, and I'll just let my guy handle everything. Well, I explain in the book that it's important to find a representative, and I explain how to find one and how they get paid. And the good news is the fee is very reasonable. They only get paid from your back benefits, your past due benefits, and there's a cap on how much they get paid. In a couple months, that cap's going up to $7,200. But in the context and the grand scheme of how much you might get in benefits, that's not a lot, right? It's a bargain. It's a great deal. The downside to that is they don't get paid very much per claim, and they only get paid if the claimant wins.
Right.
So they have to take a lot of cases because they have to assume half of those won't be approved. And of the ones that are approved, they're only getting a certain amount of money. So it's a volume business for the attorneys and non-attorney representatives. What that means is they don't have that much time to spend with you on your case. It's not like you're their only client. A Social Security disability representative may have 100 clients at any one time. They've got an hour or two to spend with you, and they'll show up at your hearing. That's it. So if you're asking questions like, tell me, what is step 5 again? I can't do the forklift driver job. Can you explain to me how they can still deny me? If you're asking questions and you're using that whole time, that whole hour that you have to sit down with your representative in their office, if you're asking questions that could be easily answered by reading my book, you're not really making great use of that time. Whereas if you know all this information coming in, you can sit down and you can immediately say to them, what do you think my RFC will be? We got this problem where I think I can sit, but I know that if I say that, I'll probably be denied because I'm under 50. How do you want to approach that? And in the first minute, you're getting into real detail and nuance of presentation of your case and in testimony versus what happens with a lot of people where they spend that whole hour having the process explained to them, and then that's just not a really good use of your time, because then you can't talk strategy, you can't go over your testimony. So yes, it's important to hire a representative because they know the process and they can help guide you and make sure you don't say something that's going to be really detrimental to your case. And that's totally allowed, by the way. Attorneys are allowed to coach their clients. They're not telling you to lie. They're just explaining, here's how we're going to present it so it's in the most favorable light to you. This is our strategy based on the definition of disability to argue that you're disabled. But at the same time, in order for you to really talk strategy, you have to be able to have that foundation under your belt first so that you can talk strategy. And unfortunately, I can just tell from reading people's records and listening to the disability hearings, I can tell that a lot of people, even if they have a representative, they just don't know the system. They don't understand the system. And when you don't understand what's going to happen, you can't advocate for yourself.
Right.
One other thing I want to say is that representative only helps you once you go to them. They take the record, the medical record that you've given them, and they strategize based on that. But if you know in advance how Social Security makes decisions, you know that sequential evaluation process, you know what you have to prove, you're the one going to see your medical sources, right? You're the one in that room with your doctor. You're the one who can say, I know, doctor, that I'm going to need physical objective evidence. When the doctor says, I'll write that you're disabled, you're the one who needs to say, no, doctor, you can't say I'm disabled. I need you to say how many hours a day I can stand and walk and sit and lift. That's what I need. If you know the process, you can advocate for yourself and you can get the specific evidence that you know you'll need later to prove your disability claim, right? The representative can't do that for you. They're stuck with whatever medical information you give them. And that's why it's really important that you know the process and you hire a professional and you work with your professional to put forth the best possible case so you can give yourself the best chance of being approved.
Absolutely. And what would you say is the one piece of advice that you would want all healthcare professionals to know to best help their patients?
That the deck is really stacked against the claimant when it comes to Social Security. It's Social Security Disability Insurance, SSDI. It's an insurance program. And even though it's run by the government, it's run like any other insurance program where it's really easy to pay into the system. That money comes right out of your paycheck. Really easy to pay in, really difficult to get money out. And I think a lot of doctors think like because this is a government program, it's neutral, it's fair, uh, a little bit of evidence, and my statement with MD after my name, that's enough for Social Security, and it's not. Doctors, the medical community overall needs to understand that Social Security will put up an endless number of barriers to try and prevent someone from accessing disability benefits that they've paid for and that they should be entitled to. That's why we call it an entitlement, right?
Right.
And so I want the medical community to understand what someone has to prove. And it really all comes down to understanding that definition of disability. Medical impairments that prevent you from doing work for more than 12 continuous months. By the way, the rules are relaxed a little bit for people over 50. And so doctors who tend to see patients who are over the age of 50, and there are certain specialties where you're seeing older patients. Maybe in a care setting, you're getting people who are in their 50s or early 60s. Well, it's important to understand how those rules change. I'll give you an example. Let's say that forklift driver is 62, not 44, or they're 64, okay? They're in their early 60s. The rules are set because it's really hard for people who are older to transition to other types of work. The rules change a little bit. And this is in the law. It's built right into the law, where that person who was doing what's considered a medium level job, if they're now limited to light work, they can be found disabled at age 62. So that forklift driver doesn't need to show that doesn't need to preclude every other job. All they need to do at that point is preclude medium work. So what their medical opinion from that doctor needs to say, that medical opinion needs to focus on the inability to lift more than 20 pounds or to bend frequently throughout the day. But you have to know that, and you have to know exactly what you need. You don't need to disprove sedentary work at that point. And so if the records can show and the medical opinion can show that that person is limited to lifting 20 pounds, they can go into the hearing and they can tell the judge, I can stand and I can lift 20 pounds, no problem. But I can't lift more than that and I can't bend a lot. Here's my medical evidence to prove it. And because of that person's age, they will be approved. Whereas that exact same person at age 44 would be denied. But you have to know the nuances of that rule, right? And I talk about that in the book. That's a chapter called The Grid Rules and how judges get around them. Because the judges also know these rules and they know they can find a way to deny that 64-year-old if they find that person can go back to that forklift job. So again, that's why it's important to know that rule. And even if you don't fully understand it, just knowing it's there allows you to go into your representative's office and say, can you explain this rule to me? Because I'm 62 and I think that this should be fairly easy. I think all we have to prove is that I can't do my password. Can you tell me about that? That's a great conversation to have with your representative. Whereas just sitting down and going, I'm in pain, I can't work, it's not very useful. It's not effective. And by the way, the judges, when they're assessing someone's credibility, they look at what someone is saying and they compare it to their medical records. And someone who says, I'm in so much pain, I need to lie down for 10 hours a day, I can't do anything. Judges tend to roll their eyes at that and say, that can't possibly be true. Whereas someone who says, here's all the things I can do, here's what I'm trying to do, I'm trying to work part-time, I'm trying to get back to my previous job, someone who shows they're trying not to need disability benefits, that's the person who's most likely to be approved for them.
Sure.
But you have to know and understand
You
that.
have to know.
The one thing I want the medical community to understand is the rules are really complicated. And even if you don't get a chance to read the entire book, there's a table of contents. You could focus on the sections that might apply most to you. For example, chapter 12 is step 5. That's what we were talking about earlier, where even if you can't do your past job, you can be denied if you can be found to do other work. If you read chapter 12 and you understand, okay, just saying the person can't be a forklift driver, that's not enough. I'm really glad I now understand that, so that I stop writing for my patients, this person can't go back to their prior job, because that's not helping them.
Right. So Spencer, you worked with SSA for, is it 12 years, I believe?
A little under 11.
Little under 11. What was your turning point to write this book and kind of say pull the curtain back on the process and showing people the pitfalls and kind of giving an insider's perspective on this?
I just saw so many cases where I could tell people were going to the process having no idea how it worked. And that's even more glaring when the person doesn't have a representative, because then they're representing themselves, and everyone kind of cringes when that happens, because we all know that's really not a good situation. And the judges really don't like that, but they can't force you to have a representative.
Sure.
But they know that those claimants who are representing themselves don't know the nuances of the law. And so, for example, when it comes time for the vocational expert to testify about their work history and what other jobs they might be able to do, the unrepresented claimant has no idea why that person's there, why they're testifying, or how to question them. And so I wanted this book to be available for people to better understand the process. But I didn't want people to think I was advocating for a DIY. There's other books that tell you how to DIY this. And after seeing people try and DIY it, I wanted to make sure my book was very clear that that is a terrible idea, that you should hire a rep. And I wanted people to know how to, because for a lot of people, it's the first time they've ever had a legal proceeding in their lives.
Sure.
It's the first time they've ever had to hire a lawyer. A lot of people think I can't afford a lawyer. And of course, the Social Security system, you don't have to pay your lawyer up front. They only get paid if you win, and they get paid directly by Social Security.
Right.
But you have to know that, right?
Right.
It's a really big and scary system. And it's made even scarier by all of these barriers that are intentionally put in your way to make you give up, to make you throw your hands in the air and say, I guess I'm not disabled, or I don't want to deal with this anymore. I'm tired, I'm in pain, I can't work, I can't pay my rent, and now I got to deal with this, and I just don't have the emotional bandwidth.
Well, let me ask you, so you'd mentioned kind of like it's a stacked deck in a way, and there's these barriers, and it's all by design to get people just to give up and, throw their hands up in the air and say, you know what, I got enough on my plate. I'm hurt. I don't feel well. I have rent due. Right. Where does that stacked deck start? Does it start as soon as that person walks in their local SSA building and say, I need to file for Social Security?
No, it starts before they ever become injured or are diagnosed with their chronic illness. And that's what to circle back to something we talked about earlier, it's because our medical record keeping in the United States is so awful.
Mm-hmm.
So even before you ever apply, you're seeing doctors and you're getting medical records. Even before you've even thought of applying, you're doing all that. But at the time you go to apply, if you then go to get those records, and maybe you're seeing like a counselor and they don't keep records, or maybe it's in-home care from a nurse and maybe they're not keeping extensive records, or you're seeing a nurse but there wasn't a doctor doing a physical exam, or you haven't been getting blood tests, or if it's COPD, you never got a pulmonary function test because you didn't think you needed it.
Right.
And so it all starts back there when you're getting your medical records, because that's the evidence in your future case. And so if you understand how that evidence is going to be used in the future when you apply, Do you know what kind of evidence you need to get now when you're in the process of getting that care? But no one thinks about that, right? They go and they apply and they get denied, and then they go hire a representative. And like I said, those representatives may be handed disorganized pile of medical evidence that doesn't show consistent treatment over time, where someone's not getting the care that they need because they can't afford it. It's not their
Sure.
fault, right?
Right.
But the representatives, they're putting the case forward with that evidence that they have and making their best argument. And a lot of times those cases are denied just because there's not great consistent evidence showing that you couldn't work for a full 12 continuous months. So really, and the system is designed that way. I can't tell you how many times I've heard a judge, someone can't work, so they don't have insurance or money, so they can't get medical care, right? And
Right.
then I can't tell you how many times I've heard a judge say, well, why weren't you getting medical care? And that person says, well, I can't afford it. I have no insurance. And the judge says, well, if you weren't getting care, I guess you didn't need it.
Yeah, sure.
I guess you're not disabled if you didn't need care, right? So you can see how that's the system, and the judges are using what they know to exist, a really poorly run, poorly organized healthcare system, and they're using it to their advantage to deny people's disability claims.
So,
So really, the deck is stacked against you from the very start.
and that is just tragic, right? Because there are many people who don't have the means to go to specialists and pay for testing and all these different things, and but the resource that could help them, they're almost, they're really not. They're being penalized because they can't go and get the testing, right?
And that's why it's so important to educate yourself on the process, how it works, and know what your options are.
Right.
Just to wrap up here, the theme of the book is be an educated claimant and hire a professional representative, and you work together as a team to present the best possible case. And there are certain things you can't control, like who the judge is. You could get a judge that pays 20% of their cases. That's considered a low paying judge.
Okay.
But that judge is still approving 1 out of every 5 cases. And so what you need to know is how to be that 1 out of 5 if you get that judge. Because you can't, the judges are randomly assigned. But if you get that judge, you have to ask yourself, how am I going to convince that judge that I'm disabled? I don't have insurance. I can't afford care. Part 4 of the book is all about here are the different things you could think about that you may not have thought about before, about ways that you can get care and get good documentation so that you have a really good medical record. Part 2 is the 5-step sequential evaluation. So you can know and understand, in our previous example, why that forklift driver has to show they also can't do sedentary work. Like we said earlier, that person shouldn't lie, but if they know that they have to show that they can't even do sedentary work, that needs to be in their medical records. So either they need to decide they're just going to withdraw their application because they don't meet the legal definition, or they need to talk to their doctor about how long can they realistically sit, not just in one chunk of time or in one full day, but in an entire week and moving forward. It may be that too much sitting aggravates the back impairment because actually sitting can really aggravate the lower lumbar spine. And so
Right.
maybe that person actually can't sit on a long-term basis, but they don't know it because they didn't have that conversation with their doctor. So everything is in the book for a reason. So if you can only read certain parts, that's fine. But actually, if you read the entire book, you get the full picture, the full scope of what the program is, how decisions are made, how hearings and appeals work, what kind of evidence judges look for, and also what to do if you're denied, how you can appeal, but also what to look out for if you're approved, because people don't understand, but even if you're approved, that is not the end of the line. You have to keep getting treatment. You have to keep getting records because Social Security conducts periodic reviews and they're going to want to see those medical records, and you're going to have to continually justify to the agency that you are still disabled, that you continue to be disabled. It doesn't end when you're approved, and you have
Right.
to know all of that, and you have to know what you can control and what you can't control, where to focus your energy, what your role is. Well, I tell you what the representative's role is, but I also tell you what your role is as the claimant. And if you're a medical professional, that way you'll know what your patient's role is in that process. So that when they're coming to you, when they're talking to you about certain things, you'll have some idea of why they're doing that.
Right. So last question, Spencer, and I appreciate your time so much because this is a topic that, again, most people may not be thinking about, or it might be they found this interview and they're listening and watching it because they're going through the process now or may soon be going through the process. So my last question I want to leave you with is, if somebody watching this right now or listening to it is getting ready to go into their local SSA building and they're going to that window to say, I need to apply for disability.
Or they're doing it online.
Or they're doing it online.
Website's right. The most efficient way to do it.
But those service representatives that help people at those windows, is there anything they need to look out for when they're going in to make that initial claim?
No, because nothing that you do initially can damage you. If you forget something in your initial application, you could submit something later. Social Security will say, give us your records. Well, if you remember later, oh, I actually did see it, you can always submit something later on. The initial application is just getting the process started. But it's a constant flow of information between you and the agency. They'll send you questionnaires. They'll ask you for your list of your doctors and list of your medication. And they'll say, is there anyone you need us to contact to get records for you? Because the agency will try and help you get your records. So it's a constant flow of information back and forth. You got to work with the agency, of course, to try and get the information, to give them the information they need. But this is a good way to wrap it up. Remember, they are not on your side. Social Security is actively trying. They'll say they're independent and neutral, but we know that that's not true, right? So they will appear that they're trying to help you, like, oh, we'll go get your medical records. Tell us where you need. But then they'll say, oh, and by the way, we also need you to go see this doctor for us, which again, we know from what we talked about at the beginning is not helpful for the claimant in almost every circumstance. So the thing that people should be thinking throughout the process is Social Security is not a neutral arbiter here. They say they are, but they're not. This is not supposed to be an adversarial process, but you should treat it like one. You should treat it as you, the claimant, versus Social Security. And make sure that you don't give them the opportunity to deny your case. That judge that I talked about that pays 1 out of every 5 cases, the one case that judge is paying out of 5 has really solid medical evidence, has solid objective evidence, such that that judge can't find a way to use his or her discretion to deny a claim. And that's where you want to be. You want to present so much evidence that Social Security doesn't have the discretion to deny your claim. If they've got that MRI that I talked about earlier with moderate degeneration and a doctor saying, my patient cannot stand more than 2 hours per day because of this damaged disc in his back, see the MRI report. There's really no room for discretion there, right? Your doctor has said exactly what you cannot do and has shown an objective reason for it. Chances are that judge is going to say, I'm going to pay this case and move on, because there will be 4 other cases where I can use my discretion to deny the case. So you want to know what you need to prove, and you want to know that from the moment you apply or even before you apply, so that you treat it like an adversarial process and you make sure that you're going to be on the winning end of this. Don't leave it up to Social Security to apply their discretion, because they will almost always apply their discretion in a way that finds you not disabled.
Right. Well, Spencer, we really appreciate your time. We're going to have a link to bishinspublishing.com so that our viewers and listeners can reach out to, as well as your social media platforms. And we highly recommend everybody needs this book. This should be part of your family book library because the information is invaluable. Being shared from somebody who was on the other side for 11 years, helping SSA, now you're doing this great work helping families and individuals who have disabilities and are going to be going through this process. Maybe not today, it could be tomorrow, or it could be next year, but we never know. But when that time comes, they'll be well equipped with your book.
That's right. We all have the same impairment, and it's called aging.
Yes.
And that can result in any other types of medical impairments throughout the years. But we're all aging, we're all constantly getting older, and that means we're all moving into that range at some point where we might be unable to work because of a medical impairment.
Absolutely. Well, thank you so much for your time today and for providing this invaluable resource.
Yeah, thanks for having me.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can leave us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to extend our appreciation to Spencer Bishins again for joining us today here at All Home Care Matters to discuss his new book, Social Security Disability Revealed. We look forward to seeing you next time here at All Home Care Matters. Thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.